OCT angiography is a specialized part of the standard OCT. It takes 70,000 pictures per second, and the computer is able to detect what's moving during those that 1 second and across those 70,000 scans. What's moving are red blood cells. So we have an indication of where the blood vessels are and that there's flow going through them. And we know that in glaucoma, there's a reduction in the number of capillaries that are seen both in the retina and in the area around the optic nerve. This is a fascinating and potentially very useful new technology, not only for diagnosis, but for it to help us to understand which kinds of glaucoma may have more vascular parts to it rather than purely pressure parts. To date, there's been good correlation between where the defects in vessels are seen and where the defects in terms of visual fields and in terms of standard OCT defects are noted. So the big question is, does this give us any information before ocular coherence tomography, the standard form? Does it give us any hint as to how to differentiate different forms of glaucoma, one from another? And the answer to the first question, unfortunately, is that it doesn't seem to show changes any earlier than regular OCT. So that was a little disappointing. And we've done some early studies, and they're not quite complete yet, but the early indication is that we're not finding any differences in the number of blood vessels between different forms of glaucoma. However, the technology is young. The information we get is only that there are blood vessels there, only that there's blood moving. It doesn't tell us anything about how fast that blood is moving or how much blood is moving through those capillaries. And I think newer technology and newer ways of interpreting the data may give us some of those insights that we haven't gotten yet.